Hello, everyone. It's Friday, December the 11th. Regretfully, we've had another 37 deaths since Wednesday. I'll read those to you in just 1 second. Nothing's more important than these, poor people that we've lost, and so let me do this first and foremost. Our 902nd death is a 71-year-old female from Greenbrier County. Our 903rd death is a 75-year-old male from Putnam County. Our 904th death is a 92-year-old female from Greenbrier County. Our 905th death, a 90-year-old female from Preston County. Our 906th death, a 77-year-old male from Wood County. Our 907th death, an 80-year-old male from Mineral County. Our 908th death, a 77-year-old male from Mineral County. Our 909th death, a 78-year-old male from Brooke County. Our 910th death, an 86-year-old male from Wood County. Our 911th death, a 75-year-old male from Kanawha County. Our 912th death, an 80-year-old male from Kanawha County. Our 913th death, a 72-year-old female from Boone County. Our 914th death, an 83-year-old male from Kanawha County. Our 915th death, an 86-year-old female from Putnam County. Our 916th death, a 42-year-old male from Raleigh County. Our 917th death, an 87-year-old female from Jackson County. Our 918th death, a 64-year-old male from Cabell County. Our 919th death, a 70-year-old male from Cabell County. Our 920th death, a 38-year-old female from Cabell County. Our 921st death, a 59-year-old male from Hancock County. Our 922nd death, a 90-year-old female from Hampshire County. Our 923rd death, an 85-year-old female from Greenbrier County. And I want to read this one again because I messed it up just a second. Our 922nd death, a 90-year-old female from Hampshire County. Our 924th death, gosh, bless this lady. Bless her. And bless all these great people. But listen to this. Our 924th death is a 101-year-old female from Wyoming County. Our 925th death is a 76-year-old male from Jefferson County. Our 926th death, a 74-year-old female from Hampshire County. Our 927th death, a 97-year-old female from Preston County. Our 928th death, a 69-year-old male from Ohio County. Our 929th death, an 82-year-old female from Ohio County. Our 930th death, a 91-year-old female from Ohio County. Our 931st death, a 90-year-old male from Ohio County. Our 932nd death, an 86-year-old male from Mineral County. Our 933rd death, a 93-year-old female from Nicholas County. Our 934th death, a 69-year-old female from Ohio County. Our 935th death, an 84-year-old female from Kanawha County. Our 936th death, a 77-year-old male from Mineral County. Our 937th death, a 95-year-old female from Mineral County. And our 938th death, a 61-year-old male from Mineral County. Well, you can see, we've just read through on Wednesday, I think there was 59 people on the list for 2 days. This is not 59, it's 37, and it's surely better than 59, but it's still horrible. And I think on Monday, the list was 42 or 3. Today, if you'll just think about this list encompasses people from an early age of 38 to an older age of 101. The weighted end is surely with our elderly, but lots and lots and lots of tremendous wisdom. Wisdom is leaving us. And our elderly, for the most part, year after year we lose some of our elderly folks. We're losing a disproportionate share of our elderly by all means. And that wisdom, that training, that experience, all those years is being passed on or could have been passed on to our youth over and over and over, and now they're gone. So in the last 24 hours, we had 942 new positive cases. That's down a little bit. Our daily positivity rate has dropped down from, I think it was at close to 7. It's at 4.07, and that's surely going the right way. I don't know if it's just a blip on a screen or whatever, but our cumulative rate is now at 3.99. It's still lots and lots better than most throughout our land, and being the U.S., but it's still not what it needs to be. Our active cases are up to almost 20,000. We almost have 40,000 that have recovered. We have a record high of 697 now patients that are hospitalized and 193 patients in the ICU units. Yesterday, we tested 18,500 and a few other West Virginians. That's terrific. But our RT number is at 1.13. It's the 13th worst in the country right now. We have a grand total of 36 counties that are in the red and the orange out of 55. As I said before, if you just went purely on the infection rate and no other rate, 54 out of 55 counties now would be based in the red. In trying to keep things open, it has surely been an incredible challenge. We continue to listen to all the experts, and the simple fact is just this. West Virginia, your numbers compared to other states are still great. Absolutely without any question, we could have a wholesale shutdown and shut down everything in this state and probably make things better. But on the other hand, who in the world wants to go through a complete shutdown of our state and bear all the consequences that we would have to bear? And there would be many, consequences that just are unmeasurable almost. So from the standpoint of then what do? Well, you listen to the experts, and the experts are clearly telling us this is coming at us from every direction known to man. There is not really any hot spot, or there is not really any small things that can be done to make it better. So what do? We continue to plead with you every day about wearing your mask and social distancing and all the stuff we talk to you about over and over and over, helping the elderly and all the stuff. And in doing so, the brass tacks facts are just this simple. From the standpoint of the United States of America, as long as we're going to be the United States of America, and I hope and pray that is forever and ever and ever, we're going to have to, in this situation, we are not China or whatever country it may be. We're not North Korea. We're not countries We're a freedom-seeking, capitalistic group of individuals that has absolutely made this country the greatest country in all the land. And with that being the case, to tell you just like it is, we're going to have to do the very best we possibly can to manage ourselves and get us through this pandemic. Nobody wants to shut things down. Nobody wants that. And absolutely, if our health experts could tell me, the bars or the restaurants in Ohio County or whatever, we could shut them down and we could stop, we could do all this and everything, then immediately I pull the trigger and I do that. But really and truly, in this situation, we all know that our ticket to get across the finish line here is the closeness to the vaccine. I'll talk to you about that in just a second. But in the meantime, I plead with you to wear your mask. I plead with you absolutely with all in me to take care of the elderly and to try to help them in every way you possibly can. Now, before I go into all the vaccine stuff and everything, and I want to tell you about that because that's major, major news, I want to tell you of news that we got yesterday out of the clear blue nowhere, and it is devastating news to the northern part of our state. We got the news yesterday, and if I mispronounce this, but I think it's Viatris is the new name that was adopted about 6 months ago for Mylan pharmacies or pharmaceuticals. They announced that they will close their Morgantown manufacturing facility by July 31st of 2021. To be perfectly honest, you're talking about 1,500 employees that will lose their jobs. And that means 1,500 great West Virginia families are going to really be affected. These are great, high-paying jobs. And absolutely, this is a shame beyond belief. This news came right out of the blue. And this afternoon, as soon as this briefing ends, in fact, I think the call is scheduled for 1 o'clock, I'll have a scheduled call with the management team of Viatris and in hopes of trying to come up with some level of option and some level of something to save these jobs. It's truly an amazing facility. There's no question about that. It's been in operation since 1965, and I think that there's still a real shot. And I know there's some really heavy lifting and lots that's got to be done. But I am, like I said, this one came from no man's land. And so this is all news to me. It came last night, came yesterday. The net of the whole thing is we're not going to give up. We're not going to give up in trying to find a way to save these jobs and whatever. But right at this moment, it is devastating news. Like I said, I'll be on this call at 1 o'clock, and we scheduled a call last night, and I've got to think that there's got to be some way. There has to be some way to save those jobs. The only other announcement I want to just touch with you just 1 second on, and it's playing baseball, minor league baseball, in the city of Charleston. I know that it came out, that Major League Baseball did not have a thing settled to be able to bring, minor league baseball back to Charleston, and obviously there still remains financial obstacles that are between the owners and West Virginia Power and the Major League Baseball, and the cities and the county as well, and I am standing ready to try to help any and everybody. I have been on the phone my office has been on the phone with Major League Baseball as recently as yesterday afternoon, and they absolutely assured us that we would have a team and we would be playing minor league baseball at the Power Park. They said there's still some rough edges that have to be worked out, but nevertheless, I am very confident that the Power will prove what a fantastic partner that they've been, and that they'll continue to be, and all this will get worked out with Major League Baseball. But right now, we don't have it worked out, and I stand ready to be able to try any way I possibly can to assist with the Major League Baseball partner, the owner's partner, the city, the county, but we got to get this done. But the Milan announcement is super devastating. Let me switch channels and go to you, and I got to read a little bit to you about the vaccine and all this and everything. But before I go there, I do want to say just this, that the lady that passed away in Wyoming County is 101 years old. It just came to me really that she was probably alive, or born, I guess, in 1919. She would have been alive, I guess, in the first pandemic. And oftentimes I talk about there's none of us. Well, there is one of us that was around. But it's an incredible life, a celebration of an incredible life, but daggone, we just hate like crazy that we're losing people because of this terrible killer that just swept across our land. It goes to really show you just how small we really are. I mean, if you'll just step back and just think about it, and just think just 1 second about this, is who's really in command? And that, in my world at least, is God above. And it shows just how fragile or primitive or whatever the word may be that we really are. And so in his power, he'll figure this out. But this to me should be just an indicator of just how supreme God above really truly is. As far as the vaccine update, the FDA's Independent Advisory Committee met yesterday to discuss Pfizer's request for emergency use authorization and will meet December the 15th to discuss Moderna's request for emergency use authorization. The FDA has not yet granted authorization for emergency use for Pfizer, the COVID-19 vaccine. We have been told within 24 hours of approval, the federal government will begin distributing vaccines to all the states. Once West Virginia receives the vaccine, we will begin distribution within 24 hours. The rollout of our COVID-19 vaccination program will be challenging. It'll take a lot of work, but without any question, between the National Guard and all the players that are working with them, they'll get this done. The Moderna vaccine today looks like we're going to settle into a total of 32,600 doses. Pfizer, as we announced earlier, I think it was 16 moving to 21 very, very quickly. Pfizer will come out a week before. Safe and effective COVID vaccines are coming to West Virginia soon, and we will be ready to get them to West Virginians. We're also working to make sure that the cost will not be a barrier for any West Virginian that will be vaccinated. I've got one more page to read to you, and that is our allocation plans, and they're all new. These are detailed allocation plans. Today, we have additional details on the allocation plan. We will get a limited supply of vaccines at first, so our team of experts are still finalizing the plan to make sure that the vaccines are available to West Virginians, starting with those who are at the highest risk. We have 2 phases for allocation, and you should see them on the screen. Phase 1 includes those at the highest risk and those that are essential frontline workers fighting this pandemic. Phase 2 is the general population. Phase 1 is broken down into 4 subsections, A through D. As we receive doses of vaccine, we will prioritize distribution in this order. Phase 1 includes hospitals, long-term care facilities, and staff, and pharmacies. Phase 1B includes community infrastructure and emergency response, public health officials, and first responders. Phase 1C includes other healthcare workers like home health providers. Phase 1D includes teachers and education staff in higher education and K through 12 and other sectors for critical services for our state. Let me back up. Phase 1D includes teachers and education staff in higher education and K through 12 and other sectors for critical services for our state, and like utility workers and transportation workers. We are planning to offer vaccines to all individuals identified in 1A through 1D within the first 6 weeks based on the allocation of vaccines. As our allocation increases and distribution occurs, we will be able to move through the phases more quickly. In phase 2, which is the general population, we will place initial emphasis on the most vulnerable in the general population based on the guidance of CDC. Now, the other thing I've said, and if you'll look, go back up to that the last slide. If you'll look, the timetable to get to the general population, we think now is probably around March the 10th or March the 15th. That's what I thought before. That's what I reported to you before, and everybody said, oh no, it'll never happen, never happen, never happen. Well, I tell you, if you don't push hard enough, nothing will ever happen. You know, I hope and pray that will happen. We all know things are fluid. We all know things take probably longer than what we think, but that's what we're pushing for. Some vaccine reminders are just this. The COVID vaccine will protect us from this virus and save lives. There's no question. Clinical trials with tens of thousands of people have demonstrated that the vaccination is highly effective and safe. These vaccines will require 2 doses, and it is extremely important to receive both doses of this vaccine. You will not be able to cross-pollinate one or the other. You will not be able to take one vaccine from the Pfizer and go to Moderna and do the other. You have to stay Pfizer or Moderna. These numbers will change, and when they do, we will announce additional phases and additional groups that we will be receiving the vaccine. And again, until you and the people who live with us are vaccinated, our best defense goes back to wearing that mask and absolutely doing the social distancing. I'm not going to go through over and over again about wearing our mask and our executive order with that. You know, I urge everyone out there. I even urge those that are in a super minority now. Those that really think that they shouldn't have to wear a mask, or those that really think the masks aren't doing any good or whatever like that, they are in such a minority, it is unbelievable. Probably in the state of West Virginia today, if we were to poll in the state of West Virginia today, I would bet that well in excess of 93 or 4% of the people in the state of West Virginia believe that we ought to be wearing a mask. Now, they don't like it, and I don't like it. But if I were in that 5 or 6 or 7 or maybe even less than that percent, you know, I would just say, okay, there's a good chance I'm wrong, but if I'm not wrong, what in the world is it going to hurt? what's it going to hurt? You know, I mean, absolutely. Absolutely. I'm not going to keep going and beating this horse. You know, I think, you know, really at the end of the day, we got to wear a mask. I encourage West Virginians to continue to get tested. The free testing map should be up there. Your drive-through pharmacy testing is available to you. Great work by Fruth and Walgreens, and we really appreciate them. We have 21 outbreaks now and 72 confirmed cases in our public schools. To be perfectly honest, it's an incredibly low number, and so a lot of good work has happened here. Long-term care facilities, we've dropped down, I think, from 117 to 112. You know, on that, we have 17 outbreaks in our churches in 12 counties. We're down just a little bit there. That's good too. Those counties are Braxton, Cabell, Fayette, Harrison, Marion, Mineral, Mingo, Nicholas, Raleigh, Taylor, Webster, and Wyoming counties. Still urge you to do everything the same way. Pew in between you, wear your mask. If you happen to be an elderly person and you've got any kind of health problems and everything, I know how incredibly important church is to you, and how you can actually end up feeling alone in that setting. It's really heartwarming and it's really, really meaningful in lots of different ways. But I would tell you, if you could just hang on here just a little bit longer and maybe get your services at home, it'd probably be a whole lot safer. Corrections now has 315 active inmate cases. It's slightly down from Wednesday. We have 232 of those cases at the Northern Correctional Facility in the regional jail there. You can see, like I've said over and over and over, how it just and goes through everybody. Corrections is still testing 10% of the faculty and staff across corrections every week, and you know, you got to hand it to them at corrections. They've done a magnificent job there. We got the flu vaccines you can get. We got 220 million and change that have been awarded now to our cities and our counties. We're kind of coming to an end on this CARES thing, and so if you've got an application that you want processed and get in, you got to hurry up and get it in. And so please try to keep doing what you're doing there. I know that's been a real lifeblood, you know, or lifeline for all of you, and in our cities and counties, and really, really important to all of our people. I encourage you about giving blood and plasma. You know, it's a way that you can really, really give back. And from the standpoint of our Red Cross, I know what a phenomenal job that they're doing each and every day, but this is absolutely really important to those that have recovered from COVID. You know, God above has given you a blessing beyond belief, and if you can do it, we would love for you to go and give blood. You know, today, another small announcement, but still big in many ways. Today, I want to thank the U.S. Health and Human Services Administration for community living, because they have donated 100,000 face coverings to the state of West Virginia for the Bureau of Senior Services this week. These face coverings will be distributed throughout West Virginia, throughout the West Virginia Aging Network, to senior centers in all 55 counties. Commissioner Roswell and all the aging staff across West Virginia continue to do amazing work. We've seen it all over the place. We were able to buy a bunch of new vehicles so they could get more and more meals out to our seniors. We've absolutely made a real commitment to our seniors, and we've got good stuff going on there. And so all that's good. And you know, I want to just end by just saying this to you just real quick, and then we'll go to all of our other experts. But yesterday, you know, I was just trying to process more and more things in my head and things that maybe I could do. So about 4:30 yesterday, I got my bird dog, and And so, and actually this is a puppy of the dog that I had forever. You know, her name was Lily. And so since she looks like her mommy all the time, I call her Little Lily. And so little Lily and I went to grouse hunt about 4:30 yesterday afternoon. And you know how oftentimes we didn't see a grouse. We didn't jump a single bird. And so there surely wasn't ever a shot fired in my shotgun or anything like this. But for about an hour, right before dark, we went. And she would run along in front of my little four-wheeler, and I would be calling to her, and from time to time, and she'd come back and just pet her and all that kind of stuff. And I thought a lot about just the beauty of West Virginia, stuff that I told you many times on here, and thinking about purchasing your hunting and fishing license early and everything. And so right at sunset, this scene I'm going to show you right now just came up, and so that's little Lily standing there, and this is overlooking the mountains throughout southern West Virginia. And I'm going to tell you, I didn't need to get a grouse yesterday, and I didn't need to shoot at something yesterday, but I'm just telling you, if you don't get out there and you don't get out in West Virginia, you don't see that. And really and truly, I don't know how it could be more beautiful. This state abounds with this every day. And so take advantage of what, our great leader of the band, Steve McDaniel, is telling us, and Chelsea Ruby, about getting out into West Virginia and enjoying the nature and enjoying the beauty of this state. If that doesn't calm your soul, and that's just, then I don't know what's wrong with you. But again, I surely sat right there, said a big prayer for all those that are really having a hard time in all this, and especially all those that we lost. But and there's my little buddy. He jumped over in my lap. So anyway, you guys, thank you so much.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. It's always great to be with each person that tunes in on the call. I want to both reinforce what the governor has said and also add a bit about the upcoming, what we perceive to be the upcoming approval by the Food and Drug Administration for the Pfizer vaccine. And then we anticipate the Moderna vaccine will follow. In the country yesterday, we had more Americans die than any other single day in the whole pandemic. And as the governor reads those names of West Virginians every day, every press brief who have died, it really reminds us that we have an immense responsibility to each other, both in this state and in this country. And people are looking for leadership. And I think the governor has certainly provided the state of West Virginia tremendous leadership. But the kind of leadership we really need is each one of our leadership and our commitment to protect ourselves and protect each other. There was an article out of an Israeli newspaper that basically stated that if enough people wear face masks and physically distance and avoid the kind of environments where we can see the rapid person-to-person spread of COVID-19, then that's actually better than a vaccine because everybody can participate. As we look at the Pfizer vaccine, we know that we're right at the precipice of having the Food and Drug Administration certify this for emergency use authorization, much as the country in the United Kingdom has done and Canada has done. Looking at all of the information, and I've certainly had an opportunity to read the research studies that have been published in scientific journals, to read the brief that has been prepared by the FDA for the most important points of this Pfizer vaccine, and will follow with the Moderna vaccine. What we see is this vaccine that we're about to get approved, I believe, for use in the United States and in West Virginia early next week is a really safe vaccine. The way it's made is really a game-changing approach. And as we've said before, it's made by expressing a synthetic small amount of genetic code that basically just is that part of the virus, that spike protein. Remember, we talked about the virus is named coronavirus because it's like the sun, that center circle that we draw when we're kids. That's the sort of the body of the virus. And those little lines that come out, the little rays that go out from the center, those are the spike proteins. And the spike proteins are where the virus binds to cells in our body. So all of the immune focus, whether it's the antibodies that President Trump got from Regeneron or the new drug that Lilly has made, or our natural immunity versus the virus, is all directed at those spike proteins. So we block the ability of the virus to get into our bodies. And this very small piece that's genetically made, synthetically man-made, and instructs our bodies to respond only against that spike protein is really safe because it's not the virus. So there's no way that anyone can get infected with that. It is really, really effective. We know that 95% of people that got this vaccine or got the Moderna vaccine, both which are made almost the same, were protected against getting COVID-19. And as we go forward, we know that the most important thing for our country and our state right now, as the governor's talked about how many counties we have turning red and looking at infection rates rising. As I said, death rates in the United States are rising. Hospital rates are rising more than ever before. And we're going to average 200,000 new cases a day in America and over 1,000 in West Virginia, is to take the vaccine. And there is a false claim that's been going around social media sites, which I want to make sure that we address, is that this vaccine has a potential to make women sterile or infertile. And that's just false. And as we look at 42,000 women who have been pregnant and infected with COVID-19, we don't see any problems with the body's natural immunity, which is at the spike protein, to interfere with pregnancies, or we haven't seen people with COVID-19 who've had any complications related to childbearing or pregnancy or delivery. And a person who has created this falsehood on social media basically identified a very small part of the spike protein, which shares some very remote similarity with a protein that's necessary to make the placenta, which is where the baby rests. But when you really look at that, and experts look at that, it's not that similar, and it's really short. So there's really no possibility that protein, that's very short, some similarity, would then would instruct our immune system to have any targeting of the placenta. So again, as we have seen a lot of misinformation on social media, this is one with misinformation. And as we follow closely 44,000 people who were part of the clinical trial for the Pfizer vaccine and 30,000 people that were part of the clinical trial for the Moderna vaccine, the only real complications we see is just like if people have gotten the shingles vaccines, is pain in the arm when you've gotten the vaccine, particularly the second vaccine. And some people feel a little punky and, like a little bit of kind of not feeling great, fatigue, and maybe a few muscle aches. And that's not being infected with the vaccine. That is your immune system revving up to then deal with the COVID virus if it ever comes and infects you. And we're also watching in the United Kingdom 2 workers who had really severe allergies that had to carry epinephrine pens had a bit of an allergic response. So right now we would recommend that people that have to carry epinephrine pens, have life-threatening allergic responses, would talk to their doctors before they will get immunized. But otherwise, these vaccines are amazingly safe. They've come at a at light speed, which is fantastic. And the way that they're made will enable us in the future to really change that time frame so that we can get this life-saving vaccine. Remember, almost 300,000 Americans have died of this life-saving vaccine to people, and start to protect our most vulnerable, as the governor said, keep our hospitals and vital functions open and functioning, and then start to build that herd immunity through the vaccine for both West Virginia and the United States. And then we'll be able to get back more as we had been to our normal lives and be able to enjoy all of the privileges that we have in the past. So thank you so much.
All right, thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good afternoon. We're back up to 500 National Guardsmen on duty. In addition to that, we've hired additional civilian personnel to carry out the missions that the governor's tasked us with, along with our DHHR and other agency partners. Just want to highlight that in addition to preparing for the vaccine piece, we also continue to provide testing support. In addition to that, we have almost 100 personnel supporting local health departments with case investigation and other activities. As the governor laid out, we have a plan based on his guidance for the phased approach, with a particular focus on the areas he gave us of stabilizing the acute care healthcare system, as well as protecting our most vulnerable population and getting at the death rate, where we know that 50% of the individuals we have lost are from long-term care and assisted living settings. Within that, also, as we go into those other groups, the governor's tasked us to focus on over age 65, because we know that's where the largest portion of our hospitalizations and our death rates are. So we will continue to focus on that today. A multi-agency effort, a whole of West Virginia approach with what we call a rock drill, ROC, rehearsal of concept, where we are down into the very details of what will happen once those vaccines arrive in the state of West Virginia. We continue to stay focused on the taskings that the governor gave us, and we'll work our best to get those accomplished as expeditiously as possible. I'll leave you with this last thing to reinforce what the governor, Dr. Marsh, have said. Governors pointed out several times that in World War II, over the period of years we participated in defeating that threat, we lost 407,316 American service members. We are already at over 293,000 Americans that we've lost. So again, I ask you on behalf of all the guardsmen, all the frontline healthcare workers, first responders, please follow the guidance that the governor's laid out to us. Wear a mask, do the things that we need to do to mitigate this spread while we work to distribute vaccines as they become available over the next several months.
Thank you, General. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. Just want to make one announcement today that effective immediately, the state will no longer be offering the in-home vault testing kit as we have for the past week or so. There are several reasons for this. One is the time lag on getting the results back, given the fact that a face-to-face interview must be done online, and then the sample taken, a sample mailed to the individual. Then the sample must be taken and then mailed back to the company. That's resulting in some longer lag times than we would like. As you know, we talked about difficulty in turnaround time with labs in many instances where that has slowed down. That ends up being around 5 days or so, which is too long, especially if someone is positive, to be able to do contact tracing and do what we need to do. We also looked at the cost of this, which is on the upper end of the scale of all of the labs we use. I want to mention that this is a high quality test. This is a PCR test, which is the gold standard for COVID testing. So we will continue to use these kits, but they will be used in other formats, other places than in home. So that is stopped at this point. So that's all I have. Thank you.
Thank you, Secretary. And last from Dr. Ayn Amjad, our State Health Officer.
Good afternoon. We do know that COVID fatigue or pandemic fatigue is affecting a lot of people. We do want to remind everyone about wearing masks or face coverings is important. The CDC does estimate that about 50% of people with COVID-19 are asymptomatic, so wearing masks and social distancing is very important. This is why we do stress these on our briefings and through various messaging and local health departments as well. So try to wash your hands, keep socially distanced, and avoid large crowds. We do know that with the holidays coming up, family gatherings are important, but wearing your masks in these situations is important as well. Social isolation is becoming a problem. People have depression and anxiety. We're seeing high rates of suicide, even overdoses in the state as well as across the country. So if you think you know someone who's suffering from these feelings of depression and isolation, please try to give them a call. And remember to wear your masks if you do need to go out shopping. If you can buy some of the supplies for your family members, especially if they're elderly, as the governor has mentioned, try to do that as well. Thank you.
Thank you, Dr. Amjad. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, I know that you were celebrating the opening of a new business in Snowshoe and that millions of dollars have been invested in Timberline and to get those resorts up and running and in top shape for the ski season. As we approach the ski season in those areas, and it'll move south into Gents and Winter Place and also up at Canaan Valley, what is the plan or what are the concerns about thousands and thousands of people coming to the state? 99% of the people who are going to be at those facilities are going to be from out of state. And with the vaccine not really hitting the general population until mid-March, where are you on the scale of we're going to take a really close look at it? We have measures in place. While skiing is an outdoor event, there are a lot of indoor activities take place at those facilities, the restaurants, the lodges, the common areas. So if you could touch on the attention being paid to the ski industry in this season, I'd appreciate it. Thank you.
Well, Kenny, as always, I appreciate your question. 3 months ago, we had extensive work, with the West Virginia Ski Association, and through that time, we came up with all kinds of guidelines and stuff that, that would be in place as far as, for the up and coming ski season. I believe with all in me that they'll do everything within their power to make things as safe as they can possibly be. From the standpoint, I think if you check, there's a really nice video that's up. It's a protocol to the guests that are coming to Snowshoe, and I'm sure the same is true at all of our different ski facilities across our state. But this video was really, really good. And I do take a little issue. I don't know that 99% of the visitors are coming from out of state, but I know that number is large. But at Snowshoe, this video, it went over all the different protocol, like that mask would be mandatory in all buildings, on all lifts, on all lift lines or lift lines, in all these different places. They said, over and over that, skiers, if they're removing their mask while they're skiing, that all that would be, that they would recommend the safety standards that they've done in the past, from the standpoint of staying, a decent distance apart from one another, just from a safety standpoint. They said, that there's all kinds of protocols that are in place, now that if you come together, stay together, meaning that the people that are coming, in a family or whatever, they want them to stay together on the slopes and whatever it's at. But these people they're on their game. Of course, the restaurants are still at 50% capacity. They're doing, again, I give them lots and lots of credit. I give lots of credit to our tourism people and all the different people that are making all the licks and making the things happen and making West Virginia be a really safe place, a safe place to come to. You know, let's go back, just go back in time. And I just thought of this while I was trying to answer that. But not long ago, the Hatfield and McCoy Trail issue was coming out. And, you know, we're going to open up our trails to our Hatfields and McCoys, you know, visitors and everything that come. And we thought, oh my gosh, you know, the sky is falling, you know, this will be a real mess and everything else. And from what I know, it was a tremendous success. It helped a lot of folks in those areas. I know in Pocahontas County that 27% of the people that work in Pocahontas County, you know, Pocahontas County are employed by the tourism industry. You know, it's just, there's just so many things that we've got to take into consideration. But I think we're in good shape, and I think our ski people will do a really good job. Of course, naturally, we'll continue to monitor in every way, and we'll continue to run to any fire, and if need be, you know, we'll step back and adjust and pivot and do whatever we have to do. But right now, I think, you know, if you really dig deeply into what they're doing and everything, I think you're going to see that these people are doing a good job, and I think they're getting ready, and I hope and pray they'll have a really successful season.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. Question about the distribution of the vaccine. My information is that the Pfizer vaccine will come out in a case, refrigerated, of course, at that low temperature. Of those cases would contain about 1,000, maybe a little less than 1,000 doses. Getting that vaccine around, is that going to be a problem once you open the case, that it will degrade to the point that it would be a non-effective vaccine? I guess this is a question to General Hoyer. Are you going to have hubs where I don't want to say first responders, but the caregivers come in order to get the vaccine, so you don't have to keep that case open so long, or could get it out as quickly as possible?
Well, before I go to the general, because he's way too humble to say this, but, you know, and it was Paul, is that correct? But Paul, that's why we got these superstars. Now, he'll be too humble to say this, but I'm going to tell you this, that if you could just see the rundown of all that they have done to be prepared to be able to handle just the very situations that your question poses, this is why we have the greatest military in the world. That's why they protect us all over the globe. That's why absolutely I plead with you to give them all the respect and love that you can possibly give, because the job they do is unflat believable. General Hoyer, you take it from there, please do.
Yes, sir, Governor. Thank you. So, as the Governor pointed out, pretty significant process, Paul, that we are working through, and that's what that rehearsal of concept is continuing to refine today. So, Pfizer vaccine is challenging in its distribution, but we'll be using the hub and spoke process. We'll have dry ice containers to move the vaccine to the actual end distribution point to maintain the integrity of the temperature. Then it'll be constituted by a pharmacist injected additional doses that may be available based on somebody not coming to work that day. We'll have plans in place to administer those vaccines, with the objective that the governor gave us is to get to those populations and not waste a single dose.
All right, thank you, Paul. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question was about the Vault home testing kits, and I know Secretary Crouch said we were going to stop doing that, but are we looking for a replacement in-home option for folks? And I know when we announced that program, we said that, we were going to try and start relying on the in-home testing a little bit more, which would free up some of the National Guard folks to help with the distribution process. So now that we don't have that anymore, does that change our manpower there? Thank you.
Charles, I'll pass to Secretary Crouch in just a second, but let me touch on this real quick. Absolutely, we want to continue to look for another methodology or another source and everything that will make things more convenient and easier, and surely, from a cost standpoint, cost effective. We just don't want to throw away our money and everything really on something that is developing issues. It takes too long. There's all kinds of complications that are going on and everything else, and it costs significantly more money. And so, with all that being said, we've got to manage the store. We've got to continue to look. And Charles, you do bring up a valid point in the fact that as our guard moves towards handling the vaccine, that really we're going to be a little bit stretched there. But we're not going to back up on our testing. We're going to keep our testing moving just like it's been moving. And we're going to continue to look for methodologies and everything that make it, even better. And so in this situation right now is not working on several different fronts. And I think that's what you heard from Secretary Crouch. But Secretary Crouch, you can add to that, but I think that pretty well sums it up.
Yes, Governor, it does. And thank you, Charles. It's a great question. This was a new approach that we wanted to try. Again, the lag time in terms of getting results back to make it not the best approach. We're looking at, and I think we mentioned before, self-testing lanes where we can use fewer individuals involved in that process, fewer guard, because the guard are pivoting over to development of and implementation of the vaccine plan. So we are looking at a variety of issues along those lines. Again, it's a quality test, so we may look actually at providing these tests to individuals who are in home. That takes a little more time. But we're exploring other options. We're trying very hard to make sure that we keep our testing numbers up as we see the guard pivot away from local health department assistance there. So that's a good question, and we'll keep you posted on how we do with that. You can certainly look on the 7-day tab on our dashboard to see what our testing numbers are daily. So thank you for that.
Great, thank you, Charles. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. I've received 2 calls from people who are very concerned because they were charged for their testing. One person went to Walgreens and was charged, I believe, $89 for a test. Another woman went to a drive-through testing site in Cabell County, and this lady's a child care operator, a child care center operator. She's not wealthy by any means. She was charged $200. Everyone's under the impression these tests are free. What happens? Are you looking into cases where people have to pay, and under what circumstances do people have to pay?
Okay, Secretary Crouch, you got to handle this one.
Yes, sir, Governor. I'd certainly like to get more information on that, Mark. I've never heard of anyone being charged $200. We do have providers out there such as clinics and others who do charge, but they bill the insurance company for that. So if someone's paying out of pocket, there are too many options out there to pay. And our free testing is located on the website, on the dashboard, that folks can find testing in almost every county, almost every day. That varies. But if you could please push us additional information on that, I'd love to do a little more investigation about those 2 cases. Thank you for alerting us to that.
All right, thank you, Mark. Next to Taylor Stuck with the Herald Dispatch.
Hi, everyone. Hi, Governor. This is Taylor. Shutdown or no shutdown, restaurants and bars, they're still struggling, as you know. And I've talked to a small business owner in Huntington, and he had some ideas. So I was just wondering if you had considered doing things like allowing third-party delivery of alcohol, the carry out of like sealed cocktails, or other options like maybe waiving fees for breweries, other things that could help the restaurant and bar industry. Thank you.
Taylor, I know we're doing all kinds of things. I mean, and I'm going to misspeak maybe on this, but I'm going to give you my best thought, okay? I think we're allowing establishments to do deliveries. And, it's there's problems with the deliveries naturally, from the standpoint of third-party deliveries are difficult to monitor, that the deliveries are being made to parties of appropriate age. And so there's issues and there's things you got to work through, but we're trying to work with we're trying to work with all these businesses to make things as good for them as we can possibly make, and still be able to do things like verifying age and that kind of stuff. And we're not sending alcohol and stuff like that to our minors or whatever. But I'll check into it a little bit more. But that's pretty much what I know.
All right, thank you. Next, we'll go to Emily Allen with West Virginia Public Broadcasting.
Hi, Governor and panel. My question is about prisons and jails at this time. I mean, I know you said, I think that things had improved since Wednesday, but more than 300 prisoners and more than 70 employees is, still more than one outbreak that we've had at a time. Do you know if the Division of Corrections and Rehabilitation or your administration is looking at doing anything differently to prevent or, mitigate the impacts of outbreaks in prisons at this time? Thanks.
Let me just say this, and I think I read through this the other day, and if I remember correctly, we've had five inmate deaths, I think, or 4 or 5. I can't recall what it was. If you think back about what happened down in McDowell County and how everybody ran to that fire, and we had a really bad situation. Think about what happened at Huttonsville when in the beginning, all of a sudden 120 inmates have it and everything, and it's going through Huttonsville like crazy, and everybody is totally scared to death, and I don't think we lost a person. These people have done an unbelievable job looking after and serving our inmates and doing great work. I think Dr. Amjad, maybe you could jump in here and have something to say, but I am telling you, it's hard to argue this. I mean, they're really doing a great job.
Yes, Governor. Emily, we have been talking with Commissioner Jividen about what is going on in the correctional facilities. They are currently doing surveillance testing at 10%, but we are having our EPI team look if there is an increase in transmission. And we'll talk with the governor more if there is any additional things we want to look at. But we look at that every day, and we talk with the commissioner, and we'll go from there. But they also do active sanitization methods if there are any outbreaks there. But we do talk with her daily, if not even twice a day, what's going on in the correctional facilities with the staff and inmates there. Thank you.
And Jordan, come back to me just one second more. There are states that have emptied certain jails, which had situations 1,000 times worse than what we've got and everything. But nevertheless, you think how our people have handled this. First of all, when they've emptied jails, they have had all kinds of outbreaks with repeat offenders and all kinds of bad situations. In our situation here, we have absolutely had everybody on standby, running to the fire, doing sanitization, absolutely on and on and on. And these people have done a heck of a job. I'll tell you this, that's all there is to it.
All right, thank you, Emily. Last question today comes from Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. With the vaccinations of the general public beginning in mid-March, is there a timetable for how long after that point it will take to get a substantial number of the population vaccinated to where we can start to see some effect on the pandemic?
I'll pass to you, Dr. Marsh, but before I do so, let me just say this, and Phil, good question, from the standpoint of here's what I think. I think the one thing that Dr. Marsh is not going to be able to answer is this, how fast is the ramp up going to be with Moderna and Pfizer or others, Johnson & Johnson or others jumping into the fold here? Now, trust me when I tell you just this. From a standpoint of business, from a standpoint of profitability, there is a bundle of people that are close on the doorstep of having vaccines as well. Having vaccines very similar to the ones that Pfizer and Moderna have. And as they jump in and this snowball starts going down the hill, there's going to be more and more and more and more available. That's the part that Dr. Marsh may miss. He may give you just the numbers on Pfizer and Moderna and all that kind of stuff. But I'm telling you what will happen, I think again, what I think is going to happen is just this. There'll be more and more manufacturers and more vaccine available. But Dr. Marsh, take it from there, please.
Thank you, Governor, and thanks for the question, Phil. I mean, as the governor said, that we anticipate a substantial ramp up of vaccines that are generated and delivered from Pfizer and Moderna, and then we perceive AstraZeneca and Johnson & Johnson being in line to present to the FDA their application for emergency use authorization as well. So we do anticipate the number of vaccines going up substantially over time. And as the governor pointed out, that the projection of when, how many people we will be able to vaccinate will be dependent on the amount of vaccine that we have. I think it's important to note that we need about 70% of the population or so to be immune to get herd immunity, and that's sort of just protection generally. But we will recommend to people that that we continue to be very good and responsible about mask wearing and physical distancing. And as we roll this out to the general population, we of course will try to prioritize, as the governor has instructed us, the people who are at the most risk of severe illness and of dying from COVID-19, because that then will save lives, as the governor has asked us to do, but also it will protect that vital capacity in our hospital systems as well. So I think as we go forward, we should see a great benefit from the vaccinations, all the way through, including as we get to the general population. But by the time everybody is vaccinated, I think that's going to depend a lot on the amount of vaccine that we have. The general and his team are very, very capable of delivering those vaccines to the places where we can immunize people very rapidly once we have sufficient vaccine to do so.
All right, thank you, Phil. Governor, I'll turn it back to you.
Okay, just a little follow-up to Phil, too. Phil, none of us know for sure. None of us, not Phil, not Dr. Marsh, not myself. And as we navigate our way through this pandemic, we all know that we're going to have to continue to adjust and everything as we go, pivot, whatever it may be. But with all that, I think that the people of West Virginia, have surely given me their trust. And with that, I've tried to tell them the very best that I could possibly tell them of what I thought and what the truth really, truly was. Really, when it really boils right down to it, I believe that this great country and our great pharmaceutical people and our great manufacturers and everything, we have always risen to the call. As far as how we handle and get the vaccines to the people, our great military and healthcare communities and everything, they will rise to the call. And as far as how we get things to our people, as far as vaccines to our general public, I hope and pray that I'm right in that it will be faster than what we think. And so with all that being said, sure, there's rough seas and sure there's going to be bumps, but I choose to be optimistic, not unrealistic, just optimistic. And when I go, before I leave, I just want to go back to that. And Jordan, if you could post that sunset, one more time, if you could pull that up real quick. and I'll talk just 1 second. You know, yesterday, or today rather, New York City just decided that they're going to shut down all indoor dining. You know, they just keep doing things in New York City where they're just reacting, and all of us have seen how New York City has responded, and all of us have probably been pretty disappointed, you know, to tell you the truth. You know, listen to me when I say this. West Virginia, you have done so good, so good. And just keep doing all the good you're doing. We're trying to do everything in our power right here, in our power. But if you'll just look at that sunset just 1 second and just think, could any of us possibly, no matter what we had done, could any of us ever have the power to create such beauty as that right here in our state of West Virginia? The state that is called almost heaven. God above sent us that right there. And God above blesses this great state every day. We're going to get through this. We're going to get through this with His help and all of your help. You've done good stuff, West Virginia. Just keep at it. We'll get through this. All of us have got to keep pulling the rope together. We've done that magnificently. We do not want to fragment. It's tough enough the way it is, but it can only get tougher when you start going in 50 different directions all at one time. Anyway, thank you a bunch for hanging in there with me. Thank you now.